So by my clock, it says 6:01. So I think we're going to have a bit of a full agenda. So we'll get cracking. So just to say that this evening, I'm very pleased to welcome Dr. Barre from Luton, and Dr. Sarah Whiteman will be joining us from the CCG to talk about the vaccine questions. And I know you've already sent some, so thank you very much to those of you who have, but equally, I know there'll be lots of questions. So we may not be able to give you all of the answers this evening, and if we can't, we'll do a follow-up email with you with those answers. So just before we get cracking and Lucy gives you a bit of a situation update for Luton, is there anything that anybody would like to ask before we go any further? Anything that anybody would like to add just before we go into the Luton update? Can't see any hands raised, so okay, well perhaps then if we get cracking, because I'm sure we're going to have a full agenda. So if we can go forward then with Lucy's update, and then we'll take some questions, and then welcome Sarah. So Dr. Sarah Whiteman is now with us. So nice to see you, Sarah. And I noticed that we also have Jane Meggett from the comms team of the CCG as well. So thank you very much for joining us, and really, really appreciate your time this evening. So thank you.
I'm Jenny Russell.
Okay. Okay, Lucy, would you like to go ahead then with the update?
Yeah, good evening, everyone. I hope everyone's well on this. It was snowing for me this morning, but it didn't last very long. So it's a very cold January day. The position in Luton since Christmas has been quite challenging. I think you will all have seen that the messages that we've been sharing and that Hazel, the leader of the council, put out quite so clearly around how worrying our position was last week. We were very close to 1,000 cases per 100,000 people. So we were pretty much 1% of our population testing positive every week. What we have seen in the days since then is quite a rapid decline in the number of cases. And what that suggests is that there was some transmission over the New Year and Christmas period, that people were meeting up in some form, not necessarily suggesting that they were meeting up outside the regulations, but whether it was people going to click and collect to get things from January sales, etc. There was definitely something that happened over the Christmas and New Year period for us to have seen such an increase and now such a decline. But we can't rest, we can't stop, because although we've got a good decline, we are still at 732 cases per 100,000. So you may remember that I always use the validated data. So my data is a couple of days out of date, but is the most accurate data. So the most accurate data that we've got is that we're 732 cases per 100,000. That is still worryingly high. You may remember that we were previously talking around 250 cases being the threshold for being concerned about rates. So we can't stop at 732. We've got a long way down to go to get back down to beneath 250 cases. And one of the things that worries me so much is our positivity rate. So our positivity rate today is still at 19%. And that means that for everyone who's tested, for every 5 people that are tested in Luton, 1 person tests positive. We really want to get that down to about 2 people out of every 100 people being tested, because that means that we've got the virus under control. As it stands, with that positivity rate, with 1 in 5 people testing positive who get tested, as soon as we relax the regulations, our numbers will shoot back up again. So we really need to be bringing those, not just our case rates down, but reducing the amount of virus that we've got in our community. Very interestingly, this week, for the first time, we've started to get some data through on estimates of how much of the new variant there is. Now, I'll remind you, I think we spoke before, that the new variant doesn't make you any iller. It's not more likely to make you die, but it is much easier to pass on between people, which means that more people stand a chance of getting ill, more people stand a chance of being admitted to hospital. And what we're seeing from the estimates is that about 83% of cases in Luton are linked to the new variant. So that says to us that we cannot relax, that we have got to keep following those 4 basic rules even more strictly than we were before. And when we come out of lockdown, we will have to continue following those 4 rules really tightly. So if you do need to go out, if you're going to work, if you're going to the supermarket or going to a place of worship, please make sure that you wash your hands regularly, that you wear your face covering, and most importantly, you keep your distance 2 meters at least from other people around you. And I know that's hard in a supermarket. And I think I may have said to you before that when I go to the supermarket, I'm a bit like a shark. I don't stop moving. And that means that I'm not close to anybody for any length of time. When you go to the supermarket, try to keep as far away from people as you possibly can and keep moving. Good news in terms of our rapid test centres. We're seeing good numbers of people still going through the rapid test centres. And what we know is lots of those people are the people who are going to work or going to the supermarket or going to places of worship. And if I could ask you to encourage your networks for people to still come to be tested. The queues that we had at Christmas have lots of capacity. We are still testing about 1,000 people a day, but we can accommodate up to twice that without too much of a problem. And we'll test people as often as they would like to be tested. So if somebody wants to call in on their way to work, that's absolutely fine. There's no limit on the number of times that somebody can come and be tested. We're still supporting primary schools, but primary schools are now going to be getting tests for staff so that those staff can be tested regularly. But if children are going to school, we're still really happy to test children that are presenting at school, and those children of care workers or those vulnerable children. I'm sure our colleagues from the CCG can probably talk to you about the hospital position slightly better than I can. I think we all know that our hospitals are under enormous pressure, and not just our hospitals, all of our services are under enormous pressure. We're going to hear about the amazing work they're doing about vaccinations, but it's the same pool of staff that are providing all of our other health services that are also providing those vaccinations, and at a time when our hospitals are under the most pressure. So we can expect to see, as our numbers come down, a delay of 2, 3 or 4 weeks before we begin to see an impact on the hospital. But at 700 cases, we're still going to be putting our hospital under pressure. So sticking to the rules, staying at home as much as you possibly can is the best way that we can protect our hospitals. Okay, Amanda, I'm going to stop there, but I'm really happy to take any questions.
Okay, thank you very much, Lucy. So yes, if we can have some questions, and then we'll move on to our CCG colleagues. So you can either raise your hand or put something into the chat. I see Mal there has his hand up. You want to ask away, Mal?
I've been asking this question for some weeks now. The data that's coming out, Bedford have age and gender data in terms of their infections. Why can't we have those? There's been notes going out that it affects the BAME community more. Why can't we see who they are, what the ethnicity breakdown is of the infections? I mean, even if it's just our group rather than advertise, it'd be good to know, to be able to advise family and friends and stuff. Just that question.
Thanks, Mel. So in terms of age and gender, I can't see any reason why we can't share that. I think that would be helpful. We are still seeing our concentration of cases in working age adults. That's where we're seeing our increases, and that's where we're concerned, which is what we would expect in a lockdown, because they are the people who are going out on a regular basis. So I'm not sure that that's a surprise for any of us. And particularly in those younger working age people, so people in their 20s to early 30s. And that's often because they're the people that are doing, you know, the agency work, the warehouse operatives, the retail work, etc., tends to be in that group. So we do know that there is a greater risk for people who are still having to go out to work because they can't work from home. So I can't see why we can't share those, and I will look at those. One of the things we've been really careful of is balancing that provision of information and providing opportunities for people to play a blame game or to make assumptions around the data. So I'm very reluctant to share, and it's a bit like what we do with the map, is we share that map but set it in a context, and we're very clear in that in the way that we deliver the map. So I'd like to do the same for a whole range of ways in which people have been affected, not just about ethnicity, but to look at age, to look at occupation, to look at gender, and to put some more context around it. But that's quite a big piece of work. So we're going to be doing that quarterly, and the first one is coming out at the end of this month and will be shared with this group. And it won't just be a chart, it will have some consideration, both of what it might mean, but also in terms of what we don't know. So what the information can't tell us and what assumptions we shouldn't make from the data. What I would remind everybody is what we know about COVID is that it particularly thrives in areas of greater deprivation, in those areas where people are more likely to have underlying conditions, more likely to be doing public-facing jobs, less likely to be able to work from home, etc. And often, in places like Luton, those are communities that have Black, Asian or minority ethnic heritage. And that's where some of that disadvantage may come from in terms of it. So I really want to set it in that context. So Mel, I really welcome your question. I would really like, once that report is shared, really welcome your thoughts and comments on it, because we want to get this right.
Could I just respond to that, please? That's really helpful, and that's really good. It's just that when we are talking to community, family, friends, and everybody else and sharing this, sorry, I do know from national data and what you've just said that is affecting the BAME community much more, and the reasons why. It's just when I try to explain and show and tell my colleagues and communities and all the other leaders that it is affecting us, I've got no data to be able to present it to them, and it's just bland data. We're saying it's all you know, our problem. So I understand it, and we'll wait until the report comes out. So just if we can have that as soon as possible, that'd be really helpful. Thank you.
Thank you.
Thank you both. Meryl, you had your hand up. Was that no, you didn't have your hand up. Okay. Okay, so we have a question in the chat from Scott, so asking about the numbers who've been vaccinated. Perhaps we can come on to that after we've heard from our CCG colleagues. And then from Shelley, we've got, can it be stressed that the information comes from detailed statistics? Was written on the council site as a statement. Shelley, do you want to ask your question if you take yourself off mute? Where are you?
Yeah,
it was to ask your question?
Yeah, it was just on the council site where it was written about BAME. A lot of people then, and it turned into a huge slanging match. I'm aware, because of the groups that I then help, right from the very beginning of COVID, that there was trying to work out some statistics about the reasoning behind, or if there was another reasoning behind, of if it's your genetics or anything that causes the issue of having more deaths, not necessarily the numbers of people getting COVID, but if it was written in a certain way that it is because you've looked into it, the reason why you want to look into it, rather than it just coming across as a statement and then perhaps then stopping the comments on the posts, then you wouldn't get that kind of argument.
Yeah, We absolutely, and you can see that Adam's written in the comments, we absolutely take that. Yeah, and it's a learning, and we unfortunately have some people, you know, in our communities and potentially outside of our communities who are all too willing to make assumptions. What we are really clear on, and one of the things that I've said all the way through, is there is not one group of people that we have any evidence to ever suggest are more likely to engage in non-compliant behaviours. What we have seen across the whole of Luton is a really fantastic commitment across all of our communities to supporting the efforts. We all find it challenging, and we all, you know, struggle to follow all of the rules all of the time. But there isn't a particular part of our community. So what I'm hoping that this quarterly report will do is it'll do exactly as you said, Shelley. It'll just explore actually some of that reasons why some communities are more affected than others, and we will look at national evidence around what all of those different factors comply with it. But what we do know is people who live in, you know, in much more crowded places, or do forward-facing jobs, or come from more deprived backgrounds because it affects their health more generally, are much more vulnerable. And the evidence is really clear on that, and we can put that out much more articulately. So thank you, Shelley, for that comment.
Thank you.
And we've got hands up from Lorraine. Lorraine, do you want to ask a question?
Hi, sorry, it's a bad hair day again.
Never, Lorraine.
What I'm going by your last comment there. You don't feel that there's not going to be a lot of take up from, you've had a lot of compliance with across the board to do with, is it to do with their, their demographics rather than their ethnicity? Because as you probably know, or probably aware of, in my community, and I'm not one of them, I'm for the vaccine, there is a lot of hesitancy.
So
a lot of hesitancy.
So we'll come on to the hesitancy, and I think that our CCG colleagues would really like to hear what you are hearing from your communities about hesitancy, because that is going to be a really big focus of work for us, Lorraine.
You're right. Okay, that's fine, and I'm pleased to work with everybody. I'm going to have a call with is it Celine? Just to talk about what I've heard, and I know there's others on here who would very much like to get our heads around and see what we can do to raise it.
Brilliant. That would be amazing. Thank you.
Actually, then that leads us quite nicely then into our CCG colleagues, and I'm not quite sure who is going to speak first, but Sarah, I'm looking to you, so I'm hoping that that's the right order of events. So if I hand over to you now, that would be fantastic. Thank you.
Thank you, Amanda, and thank you all very much, our COVID champions, for inviting us. May I introduce the team? So we have Jane Meggett, who's our Executive Director for Communications, and Anona Hoyle, who is part of her team. We also have Jenny Russell, who's our Associate Director for Nursing, and associated with us, although very much more important to you as a Luton community, is Dr. Baz Bahe, who will talk about the local perspective much more. I just wanted to say thank you for all the work you're doing. We're doing really well in Luton from a primary care network perspective. I'm sure that you all know the primary care networks. There are 5 in Luton, groups of practices who have joined together to cover populations of patients of around 30 to 50,000, and they've done fantastically well at immunising most of the over 80s as a priority group, and nearly all the care homes. I think St Mary's should be completed this week, and now we're moving on to the over 70s, over 75s and over 70s. So that's great work. There are a number of places where people can get vaccines. So there's also a regional centre in Stevenage that you may have heard about, and coming on site will be the Redgrave Children's Centre, where vaccinations will also be available. And this is about having a choice and rolling the first vaccination and the second ultimately in 12 weeks' time to as many people as we can reach, so that we have as much coverage as possible. I think from our perspective, working together with you, that getting to those hard to reach groups, absolutely what Amanda and Lorraine said, any feedback you can give us so that we can get through, helping reduce the misinformation that's going on about the vaccines, that would be really helpful. And yes, again, thank you very much for your work. I don't know, before we go to Baz, Jane, did you want to just say anything?
Absolutely, thank you, Sarah. It's also to say a very big thank you, because if we didn't have groups like yourselves who can have those conversations about what's happening locally, it would be very, very difficult for us to get the messages across, but also for us to be able to hear what's going on, and we can tailor our communication. So I think it's really important as we start to go forward in terms of different age groups that you help us to tailor the message, and also to work with Adam in the council and Amanda and other colleagues, so we don't duplicate. So thank you for inviting us, and we're here to listen. Thank you.
Shall I go then? It sounds like my cue.
Go Baz.
So I'm Dr. Barry. I'm from Woodland Avenue Surgery in Luton, and it was interesting looking at that map about the rates of COVID infections. I seem to be right in the middle of it. I think our surgery is right in the border of Saints Biscot and Leagrave, the real hotspot. So you know, believe you me, I know what it's like right in the middle of primary care when you're COVID all around you. I think I'm just going to sort of go over some of the ground that Sarah's mentioned already about networks, because it's very, very relevant to a lot of the questions I was that I saw that were sort of sent to me beforehand. So just to recap, in Luton we have 5 primary care networks. Now, networks are groups of practices that have chosen to work together, usually the population size around about 50,000. So it's important to remember there are 5 networks, and they sort of work together, but they are also separate entities. The reason that's important in sort of the vaccination point of view is that actually when the vaccination program started, you know, it was all in the news saying actually let's start with the wave 1 practices, and you know, we were asked to volunteer ourselves for wave 1 practices to start the vaccination programs, and at that time there was a very limited supply, so we were sort of limited to maybe just 1 network kicking off. And then the rest of the practices sort of joined in later when we felt ready and able to. So there was different starting times for different networks, and that might explain some of the questions that were being asked beforehand about why some patients were being asked before others. So why is the network model the best model? Well, most GP practices are already sort of set up in delivering things like you know, childhood immunizations, flu jabs, and so forth. So from the terms of, you know, the workforce, the logistics, it was a lot was already there. But obviously this COVID is, you know, the COVID vaccination was completely different in that, you know, the vaccine itself had to be treated very differently. It was in short supply. So, you know, it made sense for the networks to get together and actually work together, only deliver vaccinations from one site. So my network is called Medix PCN, very original, clever name, not. And we chose to work from Medici Medical Practice, which is, you know, probably the most suitable building that we have, where there was enough space, enough rooms, you know, and it allowed a one-way traffic of patients. So we started in early January. We were in the wave 4. The way it works in terms of the logistics is that we are told literally a few days before the vaccine of the delivery date, and as you all know, there is you know, a set of cohorts of sort of the people who are at risk that we've got to invite, and you know, as soon as we get the data delivery, you know, we get the ball rolling, start to invite people in. Now, we started off with the you know, the over 80s, and some of the sort of troubles we were facing, you know, I can speak, you know, speaking from the front line as how do we actually organize it? It's very difficult to, start a mass campaign, getting everybody in as quickly as possible in a short space of time. So we as a network hired actually quite a lot of people to do the telephoning of the over 80s. Now, as you can imagine, speaking to the elderly, and sometimes, English is, well, most of the time the English is not the first language, and then trying to explain the vaccine, even one phone call sometimes takes 5 to 10 minutes. And when you've got to arrange near enough 1,000 vaccinations in a short space of time, it does take time. So, we tried texting, we tried emailing, but actually all of those for our local community wasn't really the way forward. So it was literally phone calls to individual patients, explain the procedure, get them booked in. But, to our credit, we managed to get the vaccines appointments full up, and they were filled within a matter of days. The actual procedure itself, I'm not sure how many have actually been to Medici, but the process is we have large car park, we have people marshalling the car parks, people come at set appointment times. Our waiting times have been very, very minimal. I think on the most 5 to 10 minutes they've had to wait. I think the most anybody's had to wait is 20 minutes. And the sort of procedure is they get called through and they get seen individually in an individual room, have the vaccinations, wait there 50 minutes, then out the other end. And to date, we've done at least 3 cycles, which have gone extremely well. So as explained before, the networks started off at different times. There was a couple of networks that started before us. So so some people were saying, well, actually, we haven't been called yet. Well, that's because our network started a little bit later, only about a week or so. And there was one other network that started a week late after us. So, some people are starting to get worried and say, well, we haven't been called yet. And well, some of it depends which network you belong to. But actually, in the last couple of weeks, I think all the networks are more or less caught up, and all the high risk patients have been targeted. So to date, most networks have gone through 3 cycles, which is essentially about 3,000 patients have had their first doses. I can let you do the maths. So, that's how many people we've done. As Sarah mentioned earlier, we've actually been out to all the care homes, and most of the care homes have been done. A little bit of mopping up for patients who've been in hospital and so forth. So we've got to tidy those up. The care homes for adults with learning disabilities, they've also been done, and we've actually started on the housebound, starting with over the 80s first. So each network is going at pace. Slight sort of discrepancy in terms of which groups are being called, but we're all sort of catching up and getting to about the same sort of level. DNA rates have been absolutely minimal. Say out of 1,000, we've maybe had 4 or 5 that have not turned up. But when we do call them up, that's usually because they've been to other places or have been ill or been in hospital and so forth. In terms of, well, is there a lot of resistance? I think the short answer is it certainly is apparent in some communities. The BAME community, there is slightly more resistance to having the vaccine, and it does take a bit more time to explain. There is, unfortunately, as you all know, a lot of fake news, even in different languages. There's lots of YouTube videos on Facebook, videos in Urdu, Punjabi, Hindi, whatever language, and it's all unfortunately fake news. So that's been a real barrier. So what we've done to asked our local GPs to do is actually trying to get out there and spread the message, actually saying, look, this is not, to explain what is fake news and what isn't fake news. And we've had video clips done by local GPs, pictures of the GPs having their vaccinations themselves. I've had mine, and I'm still alive and haven't grown an extra head or anything, and I'm fine. And it's really trying to get that message out to the different communities. I think that's our priority. A couple of things that have surprised me when we've been out to their care homes. I won't name which homes. The residents find they're all done, but actually there's been a lot of resistance from the care home staff. A lot of which are from the BAME community. There's one particular home where out of a staff of 25, only 6 actually agreed to have the vaccine. And if you think, well, actually, these are the people that are looking after our most vulnerable patients, it's a bit of a worry. But that particular home, we then sent out some video clips, sent out some GPs from the same community, and a few days later, the vaccine rate picked up. So it does take a lot of time, a lot of effort to break all this fake news and try and encourage people to get vaccinated. But I think on the whole, I think Luton is doing it actually pretty well. All the networks are up and running, the numbers are picking up, vaccine supply is picking up, and I'd like to think we're in a pretty good place. I'll stop there, shall I?
Thank you. That was really interesting. And I know that we've got some questions in the chat room to say, do we have any, or is there any local or regional data on any incidents of side effects from the vaccine shots?
I mean, all I can tell you is that certainly out of the 3,000 we've done, my biggest call to arms was when somebody tripped over outside trying to get to their car. But we had one person who felt a little faint off, but that was from the alcohol wipes we used. From the actual vaccine, we've had absolutely none.
Okay, well, that's
same across the rest of the patch, Amanda. And whereas at the beginning, the first day ever Pfizer vaccine, there were 2 anaphylactic reactions, which led to the need for 15 minutes waiting after the vaccination. We haven't seen any of that across BLMK.
No.
Excellent, thank you. There's some other questions in the chat which I'll come to in just a moment, but I can see Tony's got his hand up. Tony, would you just like to ask your question? You're on mute, Tony. You're still on mute. You're still in that faraway place on that sunny beach, and we can't hear you.
Can you hear me now?
Yes, we can.
Yeah.
Thank you. Sorry, yes, I was clicking, but nothing was happening. You mentioned, Doctor, that there are 5 networks. So far, you've only mentioned 1. Would it be possible to know what the names of the 5 are?
Yeah, there's they all got weird and wonderful names. One is well, ours is Medics. There's Oasis, Eden, Hatters, and I've forgotten the other one now. Put me on the spot.
What we can do is perhaps
we can share them. Yeah.
You've got.
Is it South Luton?
We can share.
That's Hatters. Hatters. Phoenix. Sorry, yeah, Phoenix. Yeah.
Phoenix.
Yeah.
Fabulous. Thank you.
Thank you.
Okay. So just then to get down, there's some other questions from Scott to say that they've had questions in from the public. And the first one is, can you guarantee that there will be no long-term side effects of having the vaccine?
Well, I think that there's a question that's very, very commonly asked. Well, has this vaccine been studied enough? How come everything's been rushed through? And I think that there are very, very simple explanations. Actually, I think to understand some of the, you need to sort of understand that actually a lot of the scientific breakthroughs have happened before COVID even. When the other SARS viruses were out and about, there's been huge advances in sort of genetic sequencing. I think all that has taken, all that's happened before COVID arrived. So actually, if anything needs a genetic sequence, it's actually done now very, very quickly. The process of actually producing a vaccine, that's advanced over the last few years, and again, well before COVID came about. The actual process of making a vaccine and getting into a person, that's been studied and advanced before COVID. So when COVID arrived, actually the genetic sequencing was done extremely quickly, but that's thanks to technological advances which were there before. To deliver the vaccine, again, the work had been done before, so to actually deliver the vaccine was also relatively easy and straightforward. But the other thing that people may sort of don't quite understand is how can it be tested so quickly? So we could talk about, let's talk about another illness. So let's say chickenpox. Okay, so if you had a chickenpox vaccine, to ensure that it works, you need to obviously administer the vaccine and then expose the person to chickenpox. Now, chickenpox in a community like Luton, you'd hardly ever come across it, and it might take years and years for you to have enough exposure to say actually that vaccine has worked. But obviously with COVID, because the numbers have been so high, that exposure has been there all the time. So when you have the sort of the people who've had the vaccine in the test period, their exposure has been very, very high, and actually that they've been able to reach the limit of exposure very, very quickly. And the other thing they did was actually start the phase 1, phase 2, phase 3 trials a little bit earlier. So the testing's already been done, but the numbers have been quite high. But it's thanks to these sort of previous technological advances and the large numbers of exposure available because of the high numbers. That's what's been, they've been able to sort of produce the vaccine in a safe way. Now, again, in terms of side effects, if you look back in history, most of the side effects happen within sort of 60 days of the vaccine. So even before they approved the vaccine, the license was not produced till well after 60 days, by which time they had plenty of time to sort of study potential side effects. So I can safely say it is a very safe vaccine. It's been studied, but thanks to previous technology and the number of COVID patients, that's why things have been able to be done at such pace.
Thank you. And what about if you have one vaccine? So, for example, the Oxford vaccine, should the second dose be the same vaccine, and how will that be managed?
Well, at the moment, the strong advice is to have the same vaccine. So the way sort of the distribution works is that we get, say, one lot of Pfizer now, and I presume at the control centre what they've done is already earmarked the second dose is at 12 weeks. So we know that the people we've done on week 1 will be the same people we're going to do at week 12, and so that batch has sort of been reserved. I don't think there's enough data on whether we can sort of use the other vaccine to do the second dose. I'm not clever enough to answer that question, but it makes sense to sort of use the same vaccine for the second dose.
Okay, thank you. And about the rumours then that some severe reactions included convulsions, loss of feeling, use of legs, death, is completely untrue then?
That unfortunately is completely and utterly untrue. Absolutely fake news, I'm afraid.
Yeah.
But it's a sad fact of society that actually fake news spreads much, much quicker than evidence-based stuff.
And I guess
want to click on it
similar to sort of people saying, well, I've had the flu vaccine and now I've got flu. There's another question there to say that someone has heard of people having the vaccine and then got COVID-19 from the vaccine. Totally fake, I'm assuming.
Absolutely, but again, to understand the science behind it, it's actually impossible to get COVID-19 from the vaccine because the COVID-19 virus is not in the vaccine. It's just a tiny, tiny part of it, so it's impossible. So if people have got COVID from the jab, that there's only one possible explanation, and that's they were exposed before the vaccine.
Yeah.
So it's impossible.
Okay, thank you. And then some other comments in there about sending 800 texts at once caused jammed call lines and stress to older people and carers. You did sort of cover that, where you said you've learned from some of those communication methods out to the first. Yeah.
I think it depends on which cohort you deal with. I think we found very quickly. I mean, I can tell you a story about my parents who are not from Luton. They were sent text messages with an appointment. Now, my dad is 83, hardly uses his phone. And my mum loves her phone, but she can't read English. So they were both sent text messages, and between them, they managed to miss the appointments. And when I rang up, they said, "Oh, they were sent text messages." I thought, how can you deal with, the community? You've got to choose the right sort of method for the right community and the right age group. So, we found very quickly actually a phone call is probably the best way, or a phone call to a relative. But that does take a lot of time and effort.
Yeah.
It takes a lot of manpower to do that. But as we've moved down to sort of the over 75s, it's getting a little bit easier. So the phone calls are getting less. And what we're anticipating is actually move to the younger age group. Actually, that's when text messages and possible new solutions such as AccuBooks may come into its own.
Okay.
But I think it's about catering for that particular age group and particular community.
Absolutely, thank you. And you did mention it very briefly about the housebound. How are you actually dealing with the housebound?
Well, interesting. Now each practice has got a list of housebound patients, but we actually rang all over 80s in any case. And what was interesting was actually a lot of the housebound suddenly became very, very mobile. And actually half the patients that I go and regularly see at home, I saw at the centre because they were so desperate to have the vaccine. They made every effort to come in. But so, very quickly, each practice has a computer system that can do searches. So, at a click of a button, we can tell, we can search any group that we want to. So if they've been coded as housebound, over 80s, whether they had the vaccine or not, at a click of a button, we're able to get a list. And literally we just phone that list and say, well, do you need to have a vaccination at home? And actually we started our vaccinations at home on Monday. And it's a very, very simple process. We just have a practice nurse who goes out with a vaccine and goes down the list. And the list has been generated by practice staff who phone the patient and say, okay, you're truly housebound. Try and organise it in roughly the same sort of postcode, post area. The nurse picks up the vaccine and literally goes out to that area and jabs away. So we've done this week, we've literally done probably coming up to 100 housebound patients. But I think a lot of it is dependent on the practice and whether the codes have been done correctly and so forth. So yeah, of course there are going to be problems and so forth where the codes are not correct and patients haven't declared themselves as a housebound, the practice doesn't know. So if there are any such cases, then the simple thing to do is ring the practice and say, look, can you ensure that my relative or I get a visit for the jab? And so that if they're coded properly, then it should happen.
Okay, thank you. And just before I bring Lorraine in to ask her question, I just thought it would be nice to say that there is a comment in the comment box saying, I've heard from several people who've been to the Lee Grove Centre and have a wonderful service. So everyone is full of praise and very thankful. So
good.
To let you know that. So Lorraine, would you like to come in and ask your question?
Yes, it was rather interesting. Can you actually stipulate whether you want the Pfizer or the AstraZeneca Oxford University version? Because there are certain people who've done it, well, like me, for done research. They were created two different ways. And if you've got pre-existing like an immune suppressant, you may favour one more than the other. So can you stipulate which one you want?
At first, there was no choice because literally we were only had a delivery of Pfizer, and patients, if that's the one where if people have had severe allergic reactions, we advise them not to have the Pfizer one. Yeah. But as over the weeks, as we've had supplies of both, we try and sort of stick to the one that we've got the most of. So for example, in our network we have a lot more Pfizer than we have of the Oxford one. But me personally, I don't feel too strongly if a patient sort of says, actually I'd rather have that one, and we think, well, that's fine. If it's an informed choice and if you've got both in stock, then certainly I think most networks would be happy to offer the one that the patient chooses. But as long as it's an informed choice, then I think as doctors, I don't think that's a problem. Right. But supply is also an issue. That's the other thing.
Right. Okay. And what's the have you ever had to get rid of any? Because I've noticed it's going around the media about having to throw some away because I don't know, because of storage issues. I don't know.
Gosh, I mean, in our net, the short answer is we haven't wasted any.
Wow.
And I'll be very surprised actually if some of those stories were true.
No,
now, No. So there are sort of slight anomalies. I mean, you might think, what is he on about? Well, I'll tell you what I'm on about. When the Pfizer vial was produced, they said actually you can only use it for 5 doses. And literally on the very first time I withdrew the Pfizer one, I thought actually there's enough here for 6, possibly even 7.
Right.
You know, and we think, well, actually, you know, people may think, well, that's a waste, but actually, that, you know, the Pfizer licensing says it's for 5 doses. But you know, there was a lot of outcry from the GP saying, actually, look, this is potential waste. Why can't we use 6 if there's 6 available? So you know, very quickly the licensing changed to taking 6. But if, as explained earlier, if you were vaccinated in week 1, you've got to be vaccinated again in week 12. Now it'll be the same 1,000 people. Now, if you take out 6 doses of each single vial, there's potential for you know, some wastage in that. You know, for example, we had 2 vials that were contaminated, and there were some vials we could only get 5 from. So you know, we have to get the doses right, so it's the same for each, you know, week 1 and week 12. Okay? So you don't want to sort of take out the full 6 from one lot of, you know, in week 1, and then actually in week 12, when you come to do the same number, there might be some, might not be able to get the exact amount of doses. But there's no deliberate wastage of doses. That is absolutely,
so that's another
fake news.
That's another fake news. That's good for them to know. And how you find about storage of the Pfizer, because I know it's got to be done at sub-zero. How are you finding that?
Okay, it's stored at -70 where it's made. And then it's transported in carbon dioxide at slightly higher temperature, about -40, I think it is. But when it comes to the practice, it goes to a fridge, which is a normal, I don't want to say normal fridge, of a vaccination fridge at 2 to 8 degrees. But the problem with that is that it's very, very time limited. So as soon as it comes out the freezer, it's got a lifespan of 5 days.
Right.
By the time it gets to the practice, it's usually got a lifespan of about 3.5 days. So, for example, we had a delivery on Friday morning. It left Belgium on Thursday. So that's, by the time it got to us, it was 24 hours gone. Now, we don't book appointments on the first day because we don't know when the delivery is going to be. So if we book for patients, say from 9 o'clock in the morning, and the delivery doesn't get there till 2 o'clock in the afternoon, that's a lot of phone calls to make, a lot of people disappoint. So, you know, we're advised actually just book the clinic the following day. So, you know, that's 2 days gone. So then we've only got 3 days to deliver the 1,000 doses. So it's a matter of juggling around with the times, juggling around with the appointments, and as soon as you get the delivery rate, let's get them in. So that's for the Pfizer one. The Oxford AstraZeneca one's a little bit easier. It's a lot easier to store. You just need a normal vaccine fridge at 2 to 8 degrees, and the vials could stay in the fridge for 6 months.
Right. Okay. So I know where we're heading. Good. We're going to say, well, that's been very good. And also, in terms of some of the fake news going on, there was, I put on the WhatsApp group, which I don't know if you're a member of, a panel that was held, a panel Q&A by a host of doctors, which actually is set to debunk all the fake news. And I would advise anybody to listen to it. It's a video. It's on Facebook. They've uploaded it to Facebook. They're GPs from, I think, the Manchester area, and they put through another Q&A. It's probably maybe something that we could use, or a strategy that we could use here in terms of getting out the messages. And but I know that there's a work package going on to do that. So those are my questions.
I mean, in terms of the fake news that's going around, I mean, I think I see we have some Muslim community leaders. You know, that there were rumours going around saying it's not halal; it contains pork. You know, it's absolute gibberish. Where on earth do the people get that from? And yet, you know, when people put this out for some, you know, well, understandably there would be reluctant to have it, but we've got to get the message out there saying, actually, no, it's absolutely fine. It's halal. It's not a problem. And and people unfortunately also believe this stuff about the microchips. Two patients absolutely they're adamant they would not have it because they think, well, somebody will track me. It happens.
Someone's put a really useful document on the WhatsApp group by Muslim scholars, which goes into exactly about gelatine, all sorts of things, which was very helpful to me. I shared it around to my Muslim friends and neighbours, and they found it very, very helpful. So again, that's a PDF file.
We have a lot of GPs who are Muslim, and they're making videos. They're trying to get into the mosque to spread the news. And I can see Councillor Javed Hussain is here. Perhaps we can get him jabbed on video, and to say, no, it's absolutely fine.
Thank you both.
I think there was one group which, and that's the Black community, because I would say if there was a community that was particularly resistant, I would say it was that community. And again, we're trying to get our local GP leads to make videos and spread the news. So that is one area I think we definitely need a bit of help in Luton.
Yeah, and I'll be pleased to help with that. With that.
Great.
Thank you very much for that. And just do you vaccinate on the weekend? That was one of the other questions.
Well, it depends when the delivery comes, is a short answer. For example, our next delivery is going to be next Thursday. We don't get a choice when we get the delivery, so we're having to vaccinate Friday, Saturday, Sunday. And the very long days, to fit 1,000 doses in 3 days, you have to work almost 12 hours. And that's probably the longest I've ever worked. No, that's a joke. But it depends on the delivery date. But the AstraZeneca is slightly easier to use, but we're trying to prioritize the housebounds for the AstraZeneca ones purely because it's less fragile. But I think a time will come where actually there'll be more AstraZeneca vaccine than the Pfizer one, and I think the vaccination times will be more flexible, and we won't have to rush to pack in 1,000, within 2 or 3 days.
Okay. Thank you so much. We're going to have to sort of bring it to a close because we're nearly out of time. But just before we do, is there anything that anybody would like to add or comment on? And it's been really, really useful. Thank you so much to Sarah, to Jane, and to Dr. Barre. I found that really useful, and I'm sure our COVID champions will as well. What I will do, we'll follow up the questions. I saw you, Lucy. I saw you lean forward. Carry on, go on, and I'll
I was just going to say, Scott, who runs the Twitter group, one of the people who runs the Twitter group, has suggested that perhaps a video that we could do with a Q&A session.
Yeah.
I don't know whether, Dr. Barhe, that's something that you would be interested in. It reaches...
I think whatever it takes to get the BAME community in to get jabbed.
Yeah.
I really don't mind.
Yeah,
okay.
That'd be good.
That would be great, Scott. Then we'll make that happen.
Yeah, I was going to say some of our videos have reached over 40,000 people organic, and some of them 60,000. On average, we reach between 11 and 30,000 people with every post, because of people sharing it. A couple of hundred shares every time we do a video. So we're happy to host a joint one where people can maybe actually ask questions live, to like people have tonight, but also to combat some of those myths.
Super. Can I say that my team will support that? So we'll take that offline and work with you, Amanda, to do that. Yeah.
Fantastic.
I put some of the questions that were asked, the video link on the chat, and maybe that you could maybe use those question sets as a starter for 10.
I'll do a follow-up email anyway, maybe tomorrow, but perhaps Monday with and pull together all of that information so that it will all come out to you. There was just one other quick question just before we go, and that was someone had asked, and I'm sorry, that was my fault. I should have brought it up earlier. What will happen to those who refuse the jab? So what sort of plans are there in place? I know you said before about going to the care home staff and somebody talking to them, and then some of those others were picked up. But what about those that do refuse? How have you thought about how you might deal with those?
What we're doing in our network are, we don't just leave it at one phone call if they've declined. We tend to do another phone call a few days later once I've had a chance to think about things. And actually people, I would say actually most of them on the second phone call actually just change their mind and they sort of come in. So I think it's just about sort of getting the right information to them. I think that's the most important thing.
Yeah, okay, thank you.
And keep hassling them.
Thank you, thanks. And there is a comment in there saying, very useful from Dr. Barre, I'm pleased he's my doctor. So you can
Who was that from?
That's from Mal Hussein there.
I think he's just nominated himself for a live video having the vaccination done.
I think that would be a very good idea.
He hasn't even got a choice to be an anti-vaxxer now.
Excellent, thank you.
I don't mind. I mean, I've heard so many rumours. My daughter's been warning me not to do it, but I'll be there.
Really?
I'll be visiting you, yeah.
Fantastic, thank you.
Great.
We've all heard that, Mal. We'll take you up on that. Thank you. Sandra, did you have your hand up?
Yeah, I was just going to say, in the Black community, the people, I've got a group of 75 people, so I reach every day, several times a day, quite a lot of people who've got their own pulses, and they're all African Caribbean and based in Luton. But the main fear is that often there is an adverse impact from the Black community having these vaccinations, particularly as most of these stories go back to Africa. And what's come up is that there's a separate message on some of the vaccine containers saying not for use in England or the EU, only for Africa, and it lists all the countries. So people feel yet again that our people are being used differently for a vaccine, but maybe not in the UK version, but there's still no confidence in taking a vaccine in the UK.
Can I interject on that? That is a myth. That was for the India. That was a vaccine of Repabil, the old thing they were going to do, and it was actually based for India. It was licensed only for India, and that's why it said not for the UK or for Europe. So it's not the vaccine that we're talking about now. It's actually an old.
No, but it doesn't stop the. I'm just saying it doesn't stop the fear. They see the images, they're not reading all the detail.
They know all the details, but that's
You've got more people against than you have for.
Yes.
I think there's a lot of work to do to gain that confidence.
We need some advocates, Sandra. That's what we need. Advocates.
Well, I might have allergic reactions, so I'm not sure. I let Lorraine, my cousin actually in law, so Lorraine can go first.
We'll get
She's okay with, because our government's got impunity, she can go first.
We'll book you one after another, not a problem.
I've actually been contacted for mine because I'm in group 6, but I'm being contacted to be ready for it, not anything more than that. I'm actually over 60, guys, by the way.
That's probably a side effect of the vaccine, makes you look young, you see.
There you go.
Sandra, is that you looking for compliments?
No, you want to think that I'm on group 6 and 7, I think. For the vaccine.
Okay, folks. So thank you all so much. As always,
I think we've got one hand
really
up there.
Engaged, and our speakers have been brilliant. So thank you so much for that.
I wanted to say I'm happy to put out some information that gives some clear messages to my groups. I reach about 3,000 people daily.
Jane, maybe
I was going to say, I think there's so many things we can follow up and work with you to tailor them to make sure they're appropriate and targeted just right. So can we follow up? And I'll work with Amanda to do that. So thank you.
We share information, Lorraine and I. So where I see Lorraine posting, I don't post as well. Yeah.
Thank you very much.
That would be awesome. Thank you. Thank you very much.
Not everybody.
Okay, so just to let you know, our next meeting is on the 4th of February. And as always, you can email into our COVID champion inbox. As I said, I'll be following up with a bit more information for you and some links as per the chat. But again, I would just like to say a massive thank you to all of you for giving up your time. So to our speakers and to all of you, and you're doing a fantastic job. And I just would like to say thank you so much. So it is very, very much appreciated. So thank you all. Thank you, and
Okay.
see you on the 4th.
Thank you.
Thanks, Amanda.
Bye.
Bye.